Growing up, I would always have my moods change almost instantly while playing or having a casual conversation with my family. I would go from happy to mad in seconds and would take it out on my siblings. I would throw things or try and hit them and be mad for days. I would also go from having a happy conversation with my family, and then a word would be mentioned and I would get instantly depressed because the word would bring back a sad memory. I would go into a depressive state that would last for days where I couldn't do anything and nothing could help me get out of it. I decided to go to a therapist to see if they could tell me what was going on. The therapist diagnosed me with bipolar disorder. Bipolar disorder is where episodes of mood swings ranging from depressive lows to manic highs occur in a person. And then my doctor prescribed me Lamotrigine. I was finally able to hold conversations without being triggered by words that either caused me to be depressed or angry just at the mention of a word. I was finally able to communicate with my family better and able to stay happy for longer periods of time while also being collected. Lamotrigine, brand name Lamictal, is usually administered daily with the dosage range between 50 and 500 milligrams. The therapeutic effects include decreased incidence of seizures and delayed time to occurrence of mood episodes and bipolar disorder. The main action is where it stabilizes neuronal membranes by inhibiting sodium transport. Some potential common side effects include ataxia, dizziness, headache, nausea, vomiting, photosensitivity, rash, drowsiness, behavior changes, depression, insomnia, tremor, blurred vision, double vision, rhinitis, and vaginitis. Some serious adverse effects include aseptic meningitis, suicidal thoughts, kidney failure, multi-organ hypersensitivity reactions, and a rare serious disorder of the skin and mucous membranes called Stevens-Johnson syndrome. If you develop suicidal thoughts or notice flu-like symptoms followed by a painful rash that spreads and blisters, notify your healthcare physician immediately. Hi, I'm a nurse, and I'm here to tell you some important information regarding the monitoring and administration of Lamotrigine. You need to monitor the behavior of the patient and indicate the emergence or worsening of suicidal thoughts, behavior, or depression. You need to assess the patient for skin rash frequently during therapy and discontinue at the first sign of rash as it could be life-threatening. It could indicate Stevens-Johnson syndrome or toxic epidermal necrolysis. The rash usually occurs between the first 2 to 8 weeks of therapy and is more frequent in patients taking multiple anti-epileptic agents, especially valproic acid, and it's much more frequent in patients under the age of 16 years. Regards to bipolar disorders, you need to assess the mood, ideation, and behaviors frequently, and you need to initiate suicide precautions if indicated. For the lab test, you need to consider that the therapeutic Lamotrigine plasma concentration range is not established, but the proposed therapeutic range is 1 to 5 micrograms per milliliter. Lamotrigine may cause false positive results for phencyclidine and some rapid urine drug screens. Use specific analytical methods to confirm the results. If you're a nurse taking care of a patient who is being administered Lamotrigine, there are some priority nursing implications that you need to consider. You do not need to confuse Lamotrigine with lamivudine, levetiracetam, or levothyroxine. You do not confuse lamidacil with Lamisil, which is terbinafine. If the patient is taking it orally, they can be administered the medication without the regards to a meal. They do need to swallow the extended release tablet whole, and they do not need to crush, break, or chew the tablet. Lamotrigine should be discontinued gradually over at least 2 weeks, unless they need a rapid withdrawal, such as with the rash. When patients are taking the tablet by an oral disintegrating tablet, they need to place it on their tongue and then move it around in the mouth. The tablet will rapidly disintegrate and can be swallowed with or without water, and it can be taken with or without food. If the patient is being administered chewable tablets, they may be swallowed whole, chewed, or dispersed in water and fruit juice. If the tablet is chewed, they need to follow it with fruit juice or water to aid in swallowing. Only use the whole tablets and do not administer partial quantities. There is some important information that you need to include regarding patient and family education. You need to instruct the patient that they are to take the medication exactly as directed. They are to take missed doses as soon as possible unless it is almost time for the next dose. They do not need a double dose, and they are to not discontinue abruptly, as it is an anti-epileptic and it can increase the frequency of seizures. You need to instruct the patient to read the medication guide before starting the medication and with each refill, as changes may have occurred. You need to advise the patient to notify healthcare professionals immediately if there is a skin rash, fever, or swollen lymph nodes, and if there is a frequency of seizures if you are taking it as an anti-epileptic. You need to educate them that it may cause dizziness, drowsiness, and blurred vision, as those are common side effects. And you need to caution the patient that they are to avoid driving or any activities requiring alertness until the response to medication is known. You need to caution the patient to wear sunscreen and protective clothing to prevent photosensitivity reactions. You need to advise the patient and family to notify healthcare providers if the thoughts of suicide or dying are occurring. There has been an attempt to commit suicide. There is new or worsening depression or anxiety. They are feeling very agitated and reckless. They are having panic attacks, trouble sleeping, or they are having new or worse irritability. They are acting aggressive or being angry or violent. They are acting on dangerous impulses, an extreme increase in activity or talking, and there are other unusual changes in behavior and mood. For aseptic meningitis, they need to notify the healthcare provider if they have any indication of headache, fever, nausea and vomiting, and nuchal rigidity, rash, photophobia, malaise, chills, altered consciousness, and solemnness. They also need to notify the physician if they are planning to be pregnant or they are pregnant, and you need to advise patients to take a non-hormonal form of contraception while taking lamotrigine, and that they are to avoid breastfeeding. They also do not need to take acetaminophen while taking lamotrigine, because acetaminophen cancels out lamotrigine's effects.
I was finally able to feel like everyone else because I was able to stabilize my moods to where I wouldn't be just one mood for days at a time.
I couldn't be happier with its effects.